And now we're recording live from downtown Tacoma. Have we got everybody that we're going to get? Okay, if they're late, sorry, they have to join us later. But anyway.
Everyone that matters is here, but Bryce,
Yeah,
so let's get going.
Anybody who's somebody. Like I was saying, this one's going to be short and sweet. Strange sprains, dislocations, and tears. Sounds nice and violent, doesn't it? Sounds like a good party at a pirate day. Anyway, we're still on mobility, but this time we're going to talk about joints, tendons, ligaments, and cartilage. Not so much about bones, but what attaches to the bones. I always want to go fall into that song about bones. Anyway, moving on. So, hint, if you see this guy, you might see it again. Let me get a pen. There we go. Now I can write on the screen. Just like a sportscaster. Wow. Anyway.
Bryce, I have a question, Bryce. Are you going to post this immediately we are done with the Zoom?
Yeah. In fact, it takes me a while to process it. What I like to do is take the recording and download it to YouTube. And then store all my videos on YouTube. That way I just put a link on Canvas, because if I put all the videos up on Canvas, I'm using a lot of memory space. I've already got Mobility Part A posted for today. So I'm replacing last year's videos with this video. So it takes me a while, but after about an hour or so, I've got the video up online. And I'll post an announcement too, letting everybody know that. Also, the PowerPoints that were up there were the PowerPoints from last year. I might have made some modifications to them. So you'll want to go back and look at the PowerPoints again after I update everything, because there might be a few more of this guy in the new PowerPoint. So hint, hint, nod, nod, wink, wink. Anyway, did I answer your question? All righty. Mobility, same as last time. It's the act of moving, walking, exercising, ADLs, and everybody knows what an ADL is. Your job as a nurse, keep them moving, basically. How does everything connect? Well, we have joints. A joint is not what most people in Tacoma think a joint is. I'll tell you that right now. But a joint is where two bones meet. But if those two joints are bone on bone, it can be quite painful. Just ask my knees. So we have other stuff. Tendon. Tendon is where the muscle attaches to the bone. I got some interesting pictures of that when they go wrong. Another one is ligaments. Ligaments goes between the two bones, where the two bones meet. And cartilage is that padding between the joints that kind of helps with shocks and stuff. We're going to take a look at a knee joint, and that'll, oh, there it is right there. So you can see here we have the muscle attached to the bone. There it is. And that is a tendon. Cartilage kind of goes over the edge of the bone right here. And that provides some cushioning between the bone. The ligament is actually a tendon that kind of attaches the bone to the bone. Why isn't my pen drawing? Malfunction, there we go. So this right here is a ligament. There's also a capsule, for example, in the knee, there's a little capsule which has called synovium. And in here is synovial fluid. That fluid just provides a nice little pillow for your knee to work on. We also have a meniscus, which is kind of like a membrane. Where you'll see that a lot, that's only in the knee, but sometimes you'll hear people talk about, oh, I got a torn meniscus. If you get a torn meniscus from wear or sports or whatever, this little membrane kind of folds up in the knee and it causes a lot of pain. So what they do is orthoscopically, they just go in and just kind of cut that meniscus out of there, and it makes your knee feel a whole lot better. I had that done on my right knee. Moving on. Is there anything on this one? Here's parts of the bone, the femur, patella, but same thing basically. Anyway, there's a couple things you'll hear thrown around the unit as they're talking about things, lateral rotation, medial rotation. Now you remember from anatomy physiology, lateral means it's going away from the body, medial means going toward the body. This is adduction and abduction. The way I kind of remember this is abduction. When somebody abducts something, they're stealing something, right? You've been abducted. So if you're bringing the arm into the body, I'm stealing something, I'm taking something. So that's an abduction as opposed to adduction where your arms are going out. Just a little mental trick to help you remember which is which. Flexion and extension, the arm coming up and going down. Oh, you might see those terms again. Moving on, dorsiflexion, plantar flexion. Easy way to remember this is dorsal fin is that fin on the back of a dolphin or a shark. And when you have a dorsalis pedis pulse, that pulse is on the top of the foot. So the top of your foot is the dorsal side. Underneath is the planar. The planar side underneath, that's where you get plantar fasciitis, which is really painful. Any of you hikers out there that might have ever had that, it's not fun. Not fun at all. About the only other thing is pronation, supination. Supinate is when you move your thumb in like that. Pronate is when it goes out. You'll bounce into those. I really wouldn't worry about committing those to memory. So let's get into the juicy stuff. Strains, sprains, contusions, dislocations, and tears. Anybody ever see trains, planes, and automobiles? Steve Martin. That always reminds me, strains and sprains and automobiles. Anyway, that's me on a Friday. Sprain. Thing to remember here, a sprain, when you sprain your ankle, what you're actually doing is you're pulling your ligaments. Those little tendons that connect bone to bone, and we've all done it. You twist your ankle and all those bones in your ankle, they've got all these ligaments attaching them. You pull those ligaments and you get a sprained ankle. That's different than a strain. The strain involves muscle. Where did my pointer go? Arg! Anyway, the strain is when you, for example, lifting too much weight in the gym and you pull your muscle and your muscle hurts. That's a strain. And a contusion, of course, is when something, oh, there he is. I found him. Contusion is where a blow, a soft injury, where you will get actually bruising, something of that nature. So if you're ever curious what the difference between a strain and a sprain was, there it is.
I have a question.
Sure.
So maybe you'll go over this later, so stop me if you are, but for from a nursing perspective, if you were to assess someone, and how are you able to physically look and know the difference? Or is it just more on them describing it?
Sometimes you can tell. Now, a lot of these are minor injuries, so you're really not going to be dealing with them in the hospital or anything. But it's good to know because, you're a nurse. People are going to ask you about it. But you kind of just have to identify the way I would assess that is, where is the pain? If you're looking at somebody's ankle and they're moving it, and you can actually literally feel the tendons between the bones are sore, you're going to call that a sprain. Whereas if somebody was lifting something and their arm muscle their muscle is sore and hurts, then that's going to be a strain. Nobody's going to hold your feet over the fire if you use the wrong term. If you say, well, person's complaining of pain to left bicep, possible sprain, no one's going to beat you up over it, but it's probably a strain. It's probably the muscle that got pulled and hurts. There again, when somebody's walking down a staircase and twists their ankle, that's probably going to be a ligament, in which case it'll be a sprain. But I wouldn't sweat it too much. Nobody's going to, nobody's going to slap you around if you get the wrong term.
Thank
I don't
you.
know, if you're working for Nurse Ratchet, she might slap you around for using the wrong term. And contusion's pretty easy because that's always a result of a blow. You know, somebody smacked you on the leg and you got a bruise. Okay, well, that's a contusion. But this might help a little bit. There's different degrees of injury. Now, the first degree, that's where you're walking down the staircase and you twist your ankle. And it's like, ow. And you go home and you take some Advil and the next morning you're okay. There you pulled a muscle or you pulled a ligament and you're going to be okay. Second degree injury, you actually tear the tissue. You actually tear the muscle a little bit or tear the ligament a little bit. And usually if you do tear it, you're going to get a little leaking blood, and that leaking blood is going to cause ecchymosis. Ecchymosis is our technical term for bruising. Best example I ever saw, that if you ever see anybody pull their hamstring, the hamstring is on the back of your thigh. And if you ever pop your hamstring, the whole back of your leg turns black and blue. I mean, it is ugly. You'll also get some edema. Edema is swelling. That's your body rushing all those fluids and stuff to the site of the injury to try to help it heal. So you see, I got edema in there twice, don't I? Yep. I got that from the Department of Redundancy Department. Now, a third degree injury is severe tearing. Now with this, you're still getting the edema, you're still getting the ecchymosis or the bruising, but you're going to have some loss of function. Now, this is a real bad tear. That's where, you tear your bicep. You're not going to be able to use your arm. Quite often that actually requires some surgical intervention to repair the tear. I think I can picture that. Oh,
Bryce, I was remembering when you were talking, let's see, like a football player or a basketball player, he's running. And of course they after a while, they're like, wow, we should stop showing it. But I think I once saw one player, his entire hamstring just like broke like a bungee cord. That's a third degree, I assume, right?
yes, that'd be a third degree.
Almost like a fourth degree.
I have a picture. Okay, it's further on, but I do have a picture in here of an actual tissue tear. You're gonna love it. It's great. Let's move on here. There's another form of skeletal or muscular injury is dislocation. Most often, I see this most in the ER. I saw shoulders. People's shoulder dislocates. Now, the problem with dislocating shoulders is as soon as once you dislocate your shoulder once, you stretch all those ligaments out of shape. And once you stretch those ligaments out of shape, it makes it easier for you to dislocate your shoulder again and again and again. Now, we all watch Lethal Weapon, right? He could throw his shoulder out of socket on purpose. That's because it's been dislocated so many times that you can actually literally just pick up a glass of water, boom, and your shoulder dislocates. So it's not a good thing. Knees can dislocate, hips can dislocate. The more commonly I see hips break than dislocate, but you can dislocate a hip. Dislocations, one of the dangers of a dislocation, especially in a shoulder and places like that, is that they can cause some nerve damage. But if a joint is out of socket, it can impinge upon your arteries and your blood vessels. And it can end up a compartmental syndrome where the dislocation swells and it seals off the blood vessels, and suddenly your arm is blowing up. you know, the most prominent place I've seen compartmental syndrome, to be honest with you, is working down in Arizona, rattlesnake bites. Someone would get bit by a rattlesnake on the arm or the leg, and that tissue would just swell up right where the bite is. And anything distal to that swelling is getting the blood cut off. So your toes or your fingers are turning blue. And one of the ways we would treat that is by creating fascia, where we actually cut the skin to relieve the pressure. It sounds rather barbaric, but hey, it works, you know. What do you know? We're pirates anyway, right? Frequent dislocations will further loosen tissue or loosen the joint so that you dislocate it once, you're probably going to dislocate it again. Hey, there he is again. There's an x-ray of a dislocation of the shoulder. What's really fun with these guys is we would usually give them a short-acting anesthesia and give them a shot. I can't remember what the name of it was, but they would like go out for about a minute and then wake up. And while they were out, we would just grab their arm, twist it around, pull it, pop it. You've seen it on TV, you know, where the guy puts their foot on the guy's chest and grabs the arm and pulls it, it just pops back into place. It really works that way. And some doctors are really good at it. They know how to take the arm and twist it in just the right way and move it and then pop. It pops right back into place. And then they wake up and they look at you and they go, well, when are you going to fix my arm? We already did it. Tears, you'll see tears. I think this is probably more what you were talking about, Trevor. Rotor cuff tears, ligament meniscal tears, ruptured Achilles tendon. Now, what you probably saw was it's like a ruptured Achilles tendon, only it was this hamstring that ruptured and rolled up like a basketball. I think I got here you go. There you are. Now, in this guy's case, I see you, Rebecca. In this guy's case, his bicep tendon tore completely, and his bicep, the muscle is under tension, so the bicep just rolled up like a ball. I saw this once in a powerlifting contest, and the guy didn't even know he'd done it. Your body protects itself by releasing a lot of endorphins and stuff when you get an injury. So there's a guy over on the side, like this guy right here, waving at him, pointing at his bicep. And he looks at the guy and he goes, what? And then he looks down and he realizes his bicep just rolled up in his arm. But rotor cuff tear, that is your shoulder. That's when you tear ligaments or tendons in the shoulder. Meniscal, there again, the ligament attaches bone to bone. Meniscus is only in the knee. And as I was telling you, that's just a little membrane. But if you tear that membrane, it kind of balls up and causes a lot of pain in your knee. So people go in and get the meniscus scrape, is what that is. And of course, your Achilles tendon is down by your ankle. That's how they killed Achilles, by putting an arrow through his ankle. Anybody know why Achilles, his only susceptible spot was his ankle? Because his mother was a goddess and she held him by his ankle and dipped him in this protective spirit to protect him, because arrows and stuff couldn't kill Achilles. But where she held on to his ankle, there was no magic formula. So when they shot him in the ankle, that's what killed him.
I wanted to
Those
know.
of you who are Homer fans. There's a lot of you out there.
So you want us to know this for the test, right?
Oh yeah, it's definitely going to be on the test.
Perfect.
Oh well.
That was my favorite. That was my favorite Greek mythology story.
Was it?
Ending, because I don't know why, but it was.
Pick him up by the ankle, dip him in the magic solution. Yeah, that was pretty cool. Okay, let's see. Next, medical surgical management, stuff that you got to know as a nurse. I'm sure a lot of you, if you've been in sports, you've run up against RICE, rest, ice, compression, and elevation. And every time you get a sports injury or sprain something, the coach is over there yelling, Rice, Rice. But of course, you don't want to overwork the muscle, so you want rest. Rice makes the swelling go down a little bit. It helps. You don't want too much swelling or you get that compartmental syndrome. So the ice kind of helps keep the swelling down. Compression, sometimes, put wrap an ace bandage around it. And the most important thing is elevation. Keep the injury at the elevation, the level of the heart. It helps the blood flow well and helps the wound to heal. There's different schools of thought on that. Some say, okay, ice for the first 24 hours and then heat after that. It all differs from sports medicine coach to sports medicine coach. Dislocations, basically you reduce them and put them in a splint. With the shoulder, in the case of a shoulder, we have a special splint that's called a sling and swath. And the sling and swath is basically just a sling like you would put your arm in, but then it ties around your waist to keep your arm close to your body so your arm doesn't swing out like this. So if you ever hear them talk about a sling and swath, that's what they're talking about. Tears, mostly immobilization. You let them heal. The body's really good at healing partial tears. But if it tears completely or tears seriously, the doctor has to actually go in and take the tendon and the muscle and pull them together and staple them together and put it back together again. And they'll heal. They heal up pretty well. Sometimes, though, where you have a tear, you can develop scar tissue in that area, which kind of haunts you from that day on. Medications is another treatment. Of course, we've all worked out too hard in the gym, go home and do some ibuprofen. I was on a long distance trail one time and taking ibuprofen was so common, we called it vitamin I. We also call it trail Skittles, because you just like every night you were popping 3 or 4 ibuprofen. The thing about it though, and this is especially true of aspirin, watch out for GI effects. Aspirin and ibuprofen can cause a lot of stomach irritation. If somebody's got an ulcer, it's not a good thing for them to take. Also, it increases your bleeding, especially with aspirin. That's why people who've had a stroke or heart attacks take an aspirin every day, because it reduces your coagulation factor just a little bit, keeps you from throwing clots. There again, if you have a bleeding ulcer or a history of bleeding ulcer or anything bleeding, that aspirin can cause additional bleeding, which is not good. Head tumor, a bleed in the head, aneurysm, something like that. Anybody's had any kind of bleeding issues like that, you don't want to give them aspirin. And tinnitus, aspirin will cause tinnitus. Y'all know what tinnitus is?
No.
Rebecca had it right, but her mic is muted.
Ringing in the ears.
Ringing in the ears. Ringing in the ears. Somebody takes too much aspirin, they'll get ringing in the ears. So, these effects of NSAIDs you might want to remember. I don't know why, just punch, call it a guess. I don't know.
With CBD, what is it's not an official medication yet. Maybe in our lifetime it will be. What is that considered? Muscle relaxant? Is that considered a painkiller? In terms of if a client says, "Oh, I use CBD oil."
Oh,
lotion.
CBD. Okay. Drew a blank there for a minute. There's CBD cannabinoids, which have THC, and cannabinoids which don't have THC. Of course, the ones with THC can, give you some of the effects of marijuana. And of course, the one without THC is not supposed to give you any of those getting high effects. A lot of truckers I've seen use CBD oil. Truckers sit in a seat all day. So they get a lot of muscle cramping and things like that. Bad backs. Bad backs are very common in truckers. And they could use CBD oil to rub on their joints and their muscles to help it relax. I think they're great. If you get on cannabis nursing, there's actually a website. There is a nursing specialty that you can get a certificate to become a cannabis nurse, which I think is wonderful. It's an idea it's an idea ahead of its time. Because if you are suffering pain from, say, chemotherapy, and you want to use a cannabis type treatment, basically you go to the head shop and the guy goes, "Oh yeah, dude, man, I think you should use this stuff. This is really good." You know, there's nobody going over their prior medical regimen. There's nobody assessing their vitals. There's nobody looking at drug interactions. Nobody's doing any of that. Maybe if you have a progressive pain doctor, he might be doing that. And the cannabis nurse is, their specialty is to go in and see what type of cannabinoid, what kind of CBD you should use for your particular problem, and look at your medications and stuff and making sure you're not going to have any problems. The problem is nobody's willing to pay them. I mean, the head shop's not going to hire you. The pain doctors aren't going to hire you. So I looked at this at one time. I said, that's a really neat certification, but it's not going to buy me anything. So that's why it's an idea that's way ahead of its time. But I think CBD is going to become more important. I do believe in it. I think it's wonderful. I have used TBD oil on my knees because my knees are basically just shot. So yeah, I think it's great. I don't know of any, and it's got a lot less side effects. I don't know of any really bad side effects from it. Do you, Trevor?
I think that if you use, it can, there's a low risk that if you use the one with THC, it might come up in your drug tests. So that's why.
That's the biggest risk right there.
Yeah. Besides that, no, I stopped using because obviously in a couple months, quite a few months, I can no longer use any form of those kind of products, you know, in most nursing jobs. So, but
Yep.
yeah, it's I use it because I smashed my hands in the United States in the Army with a forklift, and I also had
That's not a good
pretty
idea.
bad tendonitis in my elbows because of the Army.
Yep.
So sometimes those things flare up, and I used it before I had to stop, and it's really fantastic. I hope hopefully one day it is completely decriminalized. Maybe it won't be the weed smoking it, but at least they got to get this completely decriminalized because it's good stuff, really good stuff for your joints.
I understand if you're using the CBD without the THC, it doesn't come up positive in a test, but I'm not entirely convinced. I'm still cautious about that. You know, I could probably use it because, I mean, they don't really drug test us at the college, although, you know, they could if they wanted to. But you working in a medical facility, you will be drug tested. And yes, you have to be negative for THC. So as a nurse, I would definitely avoid it. There was something else I wanted to tell you about that, but I can't remember what it is right now. I know that my experience not as far as CBD, but as far as NSAIDs go, you know, Tylenol is really good for headaches, but it's not a muscle relaxant. Whereas ibuprofen helps your muscles to relax. So I've always had a lot better luck with ibuprofen when it comes to muscle injuries, muscle tissue, muscle tears, overuse injuries, lifting too much weight at the gym, all that kind of stuff. You know, Tylenol doesn't do anything for me. Ibuprofen works really well. And one thing I wanted to point out is lately I've been, instead of doing ibuprofen, I do chondroitin MSM at night before I go to bed. And that has actually been a good substitute for ibuprofen because ibuprofen is not good for your kidneys. And too much ibuprofen is like drinking too much alcohol. It's not good for your liver. It's not good for your kidneys. Ibuprofen is mostly kidneys. Tylenol impacts your liver. But you're getting all that in pharmacology, right? Maybe, I don't know. Impaired mobility, maintain the integrity, what's that say? My picture's over the top of it. Maintain integrity of the structure until rehab can begin. There again, it's kind of like putting the like traction and things like that. Impaired mobility, though, that's a good nursing diagnosis for any of these injuries. Pain, assist, be careful with the NSAIDs. Risk of ineffective tissue perfusion, that's another nursing diagnosis. The best thing to do to make sure that they're not having any impaired tissue perfusion is check their distal pulses. Checking distal pulses and color, capillary refill, color of the skin. You want to make sure their circulation is maintaining. Oh, there's that guy again. God, he's popping up everywhere. I don't know what he's talking about. That's it, man. That was a pretty short and sweet one. Any questions on that?
Is the lecture you did earlier different than this one?
Yes.
Okay.
The one earlier had to deal with fractures and casts and hip replacements, knee replacements. If you weren't here for the lecture, I highly
was it
recommend.
recorded?
Yeah, the one at 8 o'clock. Not only are there test questions in there, but I'd highly recommend you watch it because you as nurses are going to be dealing with a lot of hip fractures and knee replacements. That's going to be your bread and butter, especially if you're in a long care facility. You're going to deal with a lot of those. And we also talk about amputations.
Where is that located in the modules?
If you go under week 3,